Hello, my name is Jolene Cicchese, and I'm a registered nurse with T.L.C. Private Home Care located in Buzzards Bay and Harwich, and this is T.L.C. Cares. Today I hope to give some good information dedicated to our seniors in the community. That's the intention of the show. Today, if you want to get your pencils out, we're going to be talking about fall prevention and taking a little quiz. So did you know that 28% of seniors age 65 and over fall every year? So that's 36 million people in the United States. That's quite a lot. Some of these can be prevented. How do you know if you could be part of that 28%? There's different things that I'm going to go over with you right now, and I want you to give a point for each one that relates to you. So if you're over the age of 65, give yourself 1 point. If you have a diagnosis of 3 or more, meaning if you have a thyroid condition, if you have cardiac disease, if you've had a stroke, if you have diabetes, give yourself a point for if you have 3 of those. If you've had a prior history of falls in the last 3 months, give yourself a point for that. If you are incontinent, meaning a little dribble or you're wearing pads and briefs, give yourself a point for that, because sometimes you cannot make it to the bathroom in time and you end up with a problem. If you have some visual impairment, if you wear glasses or bifocals, if you got diagnosed with macular degeneration, if you have diabetic retinopathies, if you have age-related changes, a decline in visual acuity, night driving is tough. Night driving is tough for me, and I'm not 65 yet. If you have a problem with depth perception, give yourself a point for that. So another one is impaired functional mobility. Do you use a walker? Do you use a cane? Do you furniture walk? Do you have to hold on every single time you're moving from place to place? If you have foot problems, that also gives you, you need to wear proper footwear. Regular soled shoes only, even inside the house. You don't want to wear your socks around the house. You could fall. Not everybody has rugs in every single room. All right, let's see. Do you have arthritis or fear of falling? Those are also included in the impaired functional mobility. So if you have any of that, give yourself another point. Are there environmental hazards? These are a lot. If you have scatter rugs, I know they're pretty. They're really not good for seniors 65 and older. If you have certain medications that increase your risk for falls. We talked about socks around the house. Do you get up too quickly? Some people move too fast and they get a little flustered and they aren't realizing, where the step is or where the uneven sidewalk is. You could trip and fall. Inclement weather. I know it's having a nice winter now, but who knows what could happen. We had that cold spell about a week ago and, things froze up. You've got to be very, very careful of that. Hold the handrails. And one that's really funny is walk like a duck. If it's inclement weather, if you take it very, very slow and walk like a duck, you'll do fine. Walk like a duck means very, very, very slow. Okay? The next one is medications. Do you take a lot of medications? Do you take 4 or more? It can be for anything, over the counter. It can be Tylenol. It can be sedatives. There's so many lists of medications that increase your risk for falls. When you come out of the hospital, if you went in for hip surgery or knee surgery, they're going to give you oxycodone. That increases your risk for falls. If you're having trouble sleeping at night and you take a melatonin or an Ambien, those increase your risk for falls. If you have a little anxiety and you take Ativan, that also increases your risk for falls. Some antidepressants increase your risk for falls, like Celexa, Lexapro, heart medications, digoxin. And, it can go through a list, and if you're unsure, Google it or ask your doctor if it really increases your risk for falls. Pain increases your risk for falls. I don't know about you, but when I stand up now, after sitting for 20, 30 minutes, I get knee pain. I get, I have to hunch over for a minute because my back hurts. I'm sure it's going to get worse as I get older, so I really have to worry about the pain and how it affects my mobility. Cognitive impairment. I can't say this enough. Anyone who has cognitive decline, whether it be Alzheimer's, dementia, stroke patients, patients who are confused, patients who are making difficult decisions and using poor judgment, people, again, who are impulsive or have a memory deficit, that is a huge red flag for a fall risk. Give yourself a point for that. Now, I wanted to demonstrate walk like a duck because someone told me this a long time ago and it stuck. So I wanted to just demonstrate what walk like a duck means. It means walk like a duck. I hope you get that good visual. So now that we've gone through the whole MAC, it's a MAC 10 assessment tool, and it tells us whether or not you're at risk for falls. And if you add up the points on the right-hand column, I'll give you a moment. If you scored 4 or more in that column, you are at risk for falls. And if you need more information, you can always, go to the internet. Make sure your children know that, you took this quiz and you're at risk for falls. What can you do? Things you can change your home with is grab bars in the bathroom, a high toilet seat. You can also use a commode to get up off the toilet, or you can use chairs that are stable, not the ones that are on wheels. Always 2 hands on the chair to stand up. Don't sit down until you feel the chair on the back of your legs. A shower chair, never a bad idea, always a good idea. Other things are carpets. Make sure that those carpets are tucked down. Double-sided tape works well in that kind of area, and please remove those dangerous scatter rugs. I know that some of them have a lot of meaning behind them, or they were passed down generation to generation, but please remove them. That will give you a little bit better peace of mind. Other things to do is to slow down. Make sure you wear socks that have grips on the bottom. They're everywhere now. You don't have to just wear the ones from the hospital. You can buy cute little ones that have the grips on the bottom, or throw your sneakers on, or throw your rubber-soled slippers on. That is the best idea. If you notice now, right now, look down at your feet. If you've got socks on, make sure after this program is over that you go and put a pair of rubber-soled slippers or some grippy socks on. Some other things that you can do at the home is, grab bars can also be in the shower. You can also put something next to your bed to help you get up out of bed or to hold on to before you get into bed. Try not to hold on to the unsteady tables. Try and, make sure that you have a good grip on something before you sit down, stand up, lay down, or get up. It's very, very important. And please, if you have step stools, do not use them. Do not use them. Give them away. Put them in the trash. It's best to buy yourself one of the grippy things that you need to reach things in high places. And if you need dishes that are on the top shelf, call your grandchildren. They'll come over and they'll get your dishes down for you. Put everything where you need at the level you can reach. We're just trying to lessen the amount of time that, lessen the risk of falling. So people who fall, things can happen to. So I have a personal story. My father, 79 years old, he was pulling up carpet in his house and working all the way up till this day. He put the rug caught in his legs and he tumbled back and he fell down. And when he went to ask my mother if she heard him fall, she said no. So he took 2 Tylenol and went to bed. The next morning he got up, he had a pretty severe headache. He went back to pulling up some more rug, and then he started vomiting. He had a subdural hematoma, which is a brain bleed, and he had to be hospitalized right away. What we didn't know was he fell, and he told my mother, but nobody told my sister or I, who are both nurses. We would have told them that, you know, go get checked for, have an MRI, have a CAT scan, something that will show you if your head is okay. He was lucky. He came through surgery twice, but then it just didn't, it wasn't his time to stay here. So the brain bleed actually took his life. So from a fall and from personal experience, please, please make sure you take falls very, very seriously. And not just at home. Make sure if you go to a restaurant or go to the post office that you're aware of, you know, the steps in the post office, the steps in the restaurant. The bathrooms in the restaurant are usually have a floor. Make sure that you hold on. Make sure that your hands aren't slippery after you wash them. And you go to open the door and the door opens too quickly and you tumble back. It's very serious. Make sure when you step off the sidewalk that you look down and actually know where you're stepping. It's very important. I was just hoping today to make an introduction of fall risk prevention. It's the first show of many that I'm going to be doing. Some of them I will be bringing on other people in the community, doctors, nurses, care managers, case managers, different people that can help the seniors in our community. But today being Heart Month, February is Heart Health Month, and Valentine's Day, that I wanted to keep you all out of the hospital. So I hope you found this useful. And if you have any questions or concerns, you can always call Born TV. You can call T.L.C. Private Home Care. Any nursing questions that relate to this program at all, share this program with your friends, because this is vital information. It could help save your life or the life of someone you love. And with that, this is T.L.C. Cares and Jolene Cicchese from T.L.C. Private Home Care. I hope this helped.